Okay, this is another sort of off the record conversation I had with a university endocrinology doctor. And, he says to me, he says, Pete, I think you're right about this diet stuff. And I said, well, thank you. What leads you to say that? And he says, in endocrinology, we were trained to prescribe drugs. We have stacks of journal articles and lecture after lecture about all the drugs. A lot of my colleagues, they think that drugs are the only thing that we have to offer. They think that diet advice is a waste of time because the patients don't follow it. But I have some patients who I know them personally, and because of that, I spend more time with them and I talk to them. And he said the drugs are not enough. He says in order to have long-term good outcomes, they need to learn this diet and exercise stuff. So I think that's an important point. Because in my experience of talking to a lot of diabetics, it's very common that the diabetic patient and their husband or wife, they think that everything's okay. They say, it's under control, it's under control, it's under control. And it's not. Diabetes is a metabolic disaster. You want to have it under the optimal control. Preferably, you want to go low-fat vegan, low-sodium vegan. And if it's a type 2 diabetic, that should be curable, especially if you catch it the sooner the better. Definitely within 4 years based on the Rob Taylor data, but even longer than that, it's often reversible. You got to hopefully try to reverse it before you've lost beta cell function in the pancreas where the insulin is made. But I just tell you this because you have to snap out of this idea that you can just take one pill and continue all these irresponsible dietary habits and whatnot. So this is coming from the expert, endocrinology or the so-called experts on diabetes. And, this is a common thing too. They're so used to patients not following any type of dietary, lifestyle, or behavior advice that they consider it almost a waste of time. So as an individual, your doctor can't cure you. You have to help with the treatment yourself, so to speak, to get optimal results. So anyways, I thought that was kind of interesting.